I'm Dr. Chris Pagnani, the founder and medical director of Rittenhouse Psychiatric Associates. I started the practice in 2012 after completing my psychiatric residency at the Johns Hopkins Hospital. At that time, I knew that I wanted to remain involved in academics and continue to surround myself with some of the brightest minds in the field. Yet I also knew that my passion had always been direct patient clinical care as opposed to research. And so in 2012, I began to serve as an instructor of psychiatry at the Johns Hopkins Hospital, and I also opened Rittenhouse Psychiatric Associates. At Rittenhouse, I believe that patients can really get the highest quality outpatient psychiatric services that are available, whether they're utilizing in-office or virtual telehealth psychiatric visits. In order to provide that type of care, we have 60 to 90-minute initial psychiatric evaluations, looking not only at whether or not there's a psychiatric illness like anxiety, depression, bipolar disorder, ADHD that's affecting a patient, but also really taking into account a patient's personality and temperament and any vulnerabilities that might be affecting the way that they're feeling, their life story and any history of traumas, and any behaviors that may be impacting their mental health, whether they be positive behaviors like positive diet, exercise, meditation, or harmful like substance use issues. We're also going to really look at a patient's medical history. So you may be surprised that after seeing one of our mental health providers, we may recommend or we may actually order lab tests like thyroid panels, blood cell counts, vitamin or hormone levels. We also may ask if we can reach out to your primary care provider or other specialists so that we can collaborate and coordinate care and make sure that everyone's on the same page. And also make sure that we just don't miss anything in terms of your treatment and our treatment recommendations. By having our providers take the time to really understand you and all the aspects that make up your mental well-being, it allows us to formulate comprehensive and holistic treatment plans for our patients. Those treatment plans may include psychotherapy, medication management, recommendations for diet, exercise, relaxation techniques, coping strategies, recommendations for vitamins or supplements. And they also may include some additional accountability and strategies for any of those behaviors that might be problematic for the person. And so being able to take advantage of your providers to manage those things can also be very fruitful. When our providers do prescribe psychiatric medications, we're always aiming to use the lowest number of medications at the lowest effective doses to limit or mitigate the risk of any side effects. You probably notice there are a lot of large national telehealth companies and psychiatrists who practice telemedicine. And we have the concern that some of those companies and some of those providers may be overly prescribing psychiatric medications, and in particular, overly prescribing controlled medications. So when our providers, sometimes those medications are indicated, but when providers at our practice use those medications, we want to make sure that we're only using them in cases where they really are necessary and at the lowest effective doses. When providers prescribe those medications at higher than necessary doses, it really can increase the risk for abuse and physiological dependence, and it can also make it more difficult for a patient to come off of those medications when it's the right time for them to do so. When you see one of our providers, we're going to discuss all this. We'll discuss the risks and the benefits of medications for your specific condition, and we'll come up with you. We'll work on a treatment plan that really fits your individualized needs. In order to maintain the academic culture that the practice has established, we do several different things. But when hiring providers, whether it be psychiatrists, psychiatric nurse practitioners, therapists, or psychologists, we're looking to hire individuals who trained at some of the best rated psychiatric hospitals in the country. We're looking to hire individuals who are published within medicine, psychiatry, or psychology. We're looking to hire providers who currently instruct or have instructed at those same top-rated psychiatric hospitals and academic centers. And We're also looking for board certified and licensed providers within the field of psychiatry and mental health. Finally, even though I started the practice is very diverse in terms of the majority of our providers are actually women. And we come from a great variation in cultural and ethnic backgrounds and religions and orientations. And all that's very important to the practice because, frankly, I think that it's important for providers to be reflective of the populations that they serve, particularly in mental health, because people are just more comfortable when they can relate to the provider on several different levels. If someone out there is interested in working with Rittenhouse Psychiatric Associates, we do get about 1 to 2 resumes per week, and we unfortunately can only offer about 2 to 3 positions per year. The reason why we restrict hiring to that degree is because if you grow too quickly, it could really jeopardize the academic culture that we've created, and it could impact the quality of care that we give to our patients. I believe that our positions are in such high demand among mental health professionals because we're a 100% founder and physician owned company. And we're a 100% provider-led company, and we have no outside influence. We do not involve ourselves with private equity or big business or even insurance companies. And so what that means for our providers and for our patients is that providers can operate in an autonomous fashion in the way that they were trained to do so, without pressure from business to increase their volume of patients, to decrease the amount of time that they spend with patients, to decrease the amount of time that they have to collaborate with providers within or outside of the practice, or decrease the amount of time that they can spend with family visits with patients, with not only their families, but significant others. So basically, by not involving outside influence, I feel that providers are able to operate in a way where they can provide the best patient care that they possibly can. And finally, whether you decide to utilize our mental health services or not, I do really hope that you find the resources and educational materials on our website and on our YouTube channel helpful for whatever you or your loved ones are struggling with. Thank you again for visiting.